Today's date is August 15th, 2015, and this is my video discussion for week 2. Now, I actually took a little bit of time. I had some trouble deciding what I was going to choose as a subject because there was no subject posted on eClass. So I was brainstorming a little bit and thought about some things that happened just this week, and I actually decided to choose professionalism. And the reason I wanted to talk about professionalism is mainly because it's very important. It's important to know how to present yourself, especially when you're the new guy, when you're a student working in the OR. For me, I'm a student in the surgical tech program, so I go to a hospital and clinicals, and I work with surgeons and other medical professionals. It's very, very important that I try to present myself as a professional. And according to Webster's dictionary, the definition of professionalism is the skill, good judgment, and polite behavior that is expected from a person who is trained to do a job well. And I actually find that as an interesting definition because in the military we actually called that military bearing. When in the military is like, oh, it's all about your posture, your tone, always make sure you're well kept, how you address people, your uniform, make sure your patches are all straight, make sure your hair isn't long enough, make sure you're clean shaven. When you're addressing people, talk direct, don't talk with your hands, look them square in the eye. When you're speaking to officers, yes sir, no sir. When you're talking to NCOs, yes sergeant, no sergeant, yes first sergeant, no first sergeant. That's a sign of respect. And here it's pretty much the same thing, right? Appearance, very, very important. When you come in, you need to be dressed appropriately. You don't come in wearing anything crazy. For students, we're supposed to be in business casual, whether we're at clinic or whether we're in class, because that's how you should present yourself when you're going to work. Hygiene, that's important. Take a shower, clean yourself off. Don't come in there, smelling bad. Put on some deodorant. Brush your teeth, comb your hair. Shave if you have to. There's nothing wrong with taking a little bit of time to make yourself presentable. The people you're coming here working with surgeons, you're doing surgery. People around you need to know that you take the job seriously enough to take care of yourself before you come into work. I mean, if you really think about it, say for example, you're having surgery, and the surgeon comes in wearing, flip-flops, shorts, and a straw hat, and he's chewing tobacco. Could you imagine you're getting ready for surgery and this surgeon comes in looking like that? Would you want him performing surgery on you that day? Well, I can tell you I wouldn't, because obviously he doesn't take this job seriously enough to come in looking presentable and professional just to make me feel better. He obviously doesn't care. So he might not take my surgery seriously. So you have to be cognizant of how you look. And you might be saying, oh well, that's not a big deal. Well, you'd be surprised. It's funny because I actually haven't seen any surgeons who come in that bad, but I've seen a few who pretty close to this. Nobody chewing tobacco, but it's almost been like that. And I've seen other surgeons who come in with a full suit, and I can tell that guy, he takes his job seriously. I wouldn't mind have him working on me. Another subject that's important for professionalism is communication. Communication is important because you need to know how to talk to people, basically. You have to be polite. You know? So when you wake up in the morning, it's early, you're tired, you come to work, everyone else is tired. Put a smile on your face. Be kind. Try to be jolly. Say good morning to people. Don't come in with a scowl and a bad attitude, because no one wants to deal with that. And you'll come into places where everyone has a bad attitude. So if you're positive, if you're happy, people like having those individuals around more often. If you come in and you're patient and you're all mean and rude to them, that's unprofessional. Don't do that. Say hi. How are you doing? Smile at them. Try and help them out. Try to be comforting. Bedside manner. As surg techs, we don't get a lot of interpersonal time with the patients, but you might have a little bit of time to just say hello, good morning, how are you doing? There's nothing wrong with that, and that is professional. If they look at you, don't just try to ignore them. You might be focused on what you're doing, but there's nothing wrong with turning around, waving, and say, hey, how you doing? How you doing, Jerry? How you doing, Steven? Good morning. Nothing wrong with that at all. Also, try to be helpful when you're in the OR. My instructor's always telling us, people can be selfish. People can be arrogant. They think they're too good to do certain things. And you're never too good to get down and do jobs that other people aren't doing. People are too quick to want to go home. When you're in the OR, try to be helpful. Try to offer your assistance. If you see someone struggling with something, say, hey, can I help you? Hey, you need any help? Try and go over, try and help the patient, bedside manner, or something small, or something that people would take as small and insignificant. Pick up some trash. Take the trash out. Wipe something down. Don't try to be the first one to go home early. And it's funny that I brought up my instructor, because she is so right. After she told us that, I actually kind of looked around at my clinic site, and there are a lot of people who really are like that. They're just too quick to want to go. They just complain all day long. They don't want to help other people. They're too quick to go home. They say, oh, I want to go home. Oh, I need to hurry up and sign that list so I can get out of here early. Don't be that person. Even if you do go home early, before you leave, check around and say, hey, I'm taking off. Does anybody need anything before I leave? There's nothing wrong with that. Teamwork. That's important. At the end of the day, you have to remember it's really not about you. At the end of the day, the only thing that really matters is your patients and the people you work with. That's what matters. It's not you got to take yourself out of the equation. You got to think about others. That should be your focus. All of the things I just brought up are good examples of professionalism, or what I think professionalism is or should be. Now, the reason I actually chose professionalism is because this week was actually a pretty interesting week for me. I did my cases like normal, but earlier this week, I actually got to scrub on an orthopedic case for a prisoner. So I don't know 100% what the details are. I didn't try to look anything up, anything like that. But I guess this particular individual was in custody for murder. So it was a murder case. And now, maybe it's because I'm still new to this job as a surgical technologist, or maybe it's because I'm a little naive. I don't know. It's probably a bit of both. Normally, I wouldn't consider this a big deal. Just another patient to me, right? I wouldn't have considered this to be a big deal if it weren't for the fact that everyone around me made this a big deal. And it was actually very strange to me. I don't know why, because I've actually been in a similar situation. When I was in Afghanistan, we had a